have Dr. Joe Landers here to answer your questions this morning, and he has brought along Darla this morning. Good morning.
Good morning. How are you doing?
Very good.
Darla is
cute dog.
She really is. She's like a huge Jack Russell. She's kind of a terrier dog, and she's actually got 3 siblings, and they're just big, big, big. If you know what an Airedale is, she'll probably be about that size, which is between 50 and 70 somewhere. So she's a little bit bigger. She's actually 4.5 months old. She's over at Arrow Springs. Very nice little dog. I'd say little dog. She's obviously barely kind of fits on my lap, but she's calm. Some of the others are not as much if you like a little bit more activity a little bit. But Arrow Springs is 918-455-7107.
And we can also find her at animalaid.org.
.org on the net. You bet. Thank you.
All right. 4.5 months old and already that big.
Yeah, she's a pretty good size.
Be a big girl.
I've got her on my lap here, and I've got her kind of curled up, but she's thinking about getting a lot bigger, aren't you?
Yeah, well, very, very cute. Let's get to the phones. We have Joshua first up this morning. Good morning, Josh.
Yes, I have a question. I have a dog. It's about a year old, and he has allergies. And we've tried things like Benadryl. We've tried changing his soap, just anything like that. And we're not well off to take him to the vet and get all these allergy shots. So I was wondering what may possibly be causing these, and what's the cheapest way to maybe fix that?
Well, there's a lot of different things. There can be some food, and there can certainly be a lot of allergens. Right now, I think ragweed is up a little bit. I didn't look this morning, but it certainly was last week. You can hear me, I'm a little bit nasally. So there's a lot of different allergens. There's indoor and outdoor allergens, of course. One of the things you can do is what's called a food trial. You can get a totally different food than you've used it before. At 1 year, it's about time to probably change from puppy food to an adult food. So a lot of times it's a good time to try, say, some lamb and rice or something and feed it exclusively and see how we do on that. Definitely some antihistamines will help, Claritin, depending on the size of the dog, or some Benadryl. But things like that, if it gets really severe and they get a lot of infection and stuff, you're going to have to get some antibiotics. The other deal is no fleas. If you see any fleas, start all over, get rid of the fleas and go from there, because a lot of allergies are solved by killing fleas.
So people have allergies, and the pets having them right now too. It's a bad time of year for sure.
I don't have fleas, by the way. I just wanted to clarify that.
That's good to know. I'd be a little concerned if you did. Next up, we have Deborah on the phone. Good morning, Deborah.
Good morning.
What's your question?
I have an 8-year-old cat here, and she's always done real good at just playful bites and stuff. But just recently, about the last couple of weeks, sometimes when she comes up and just wants to play, she's doing a little bit more than playful bites. Like on my husband's ankle a couple of days ago, she did more than that. She bit him, and she had some marks left on his ankles. And I thought, what can you do to stop this before it gets too serious?
You betcha. Is she 8 months or 8 years?
8 years.
8 years, yep. And that's a little unusual, because usually by now they kind of decide how hard they're going to bite and go on. Sometimes if that kind of behavior happens, first I do what's called avoidance. If I know that if I pass around or they're doing that little hunting behavior where they squat down and they're ready to attack, I try to avoid the situation. That is, walk the other way or make sure to not walk, because they like to hit things that are kind of running. Then on top of that, sometimes a couple of things. One, a water bottle. So as we go to attack, we squirt them with a water bottle, try to avoid that. And sometimes if they're starting to break your skin and stuff, you need to get like a little fly swatter or something and just kind of shoo them off before they get to you. And then the third thing is, if you do it 2 or 3 times to me, I'm going to give you a timeout. I'm going to put you in a carrier room, and you're out for a while. So, and try to break that behavior pattern, because that's kind of playful, getting a little rough, kind of like the football players were in high school. I wrestled, I got beat up a lot, so I just avoided them.
Good tips for people and pets there.
Absolutely.
Thank you, Doctor. And if you would like to adopt Darla again, go to animalaid.org online. And if you'd like to watch the segment again, you can on our website. Just go to kjrh.com.